Hi everyone, this is Dr. K. I wanted to quickly touch up on something that I never talked about before. This is about quitting. I was recently in contact with some nurses and doctors in New York City, and trying to figure out like what was happening there. One of the biggest fears that a lot of my clients and friends, hi Lorena, one of the biggest fears they have is, am I going to die? Which is a valid fear. A lot of people are dying still, and there's infection is spreading and so forth. So that's a valid concern. So if you look at the system in Italy, there were so many deaths there when this all started. And one of the biggest criticisms is their healthcare system is full of corruption, and there's a lot of systematic problems. So I have never been to Italy, so I can't tell you firsthand. But based on some of the doctors who work there, there are systematic problems. So they don't have good resources. So that may be one reason why there were so many deaths in Italy. So I was wondering what was happening in New York City. One of the issues that we noticed was there was big issue with shortage of staff. Typically in the ICU, we give 1 or 2 patients for each nurse, and at the peak of the crisis, they were giving 7 to 11 patients to each ICU nurse, which is unheard of. There may be logistical problems. They were really hit hard, and they were probably not prepared, and a lot of those hospitals don't have money. They are community hospitals. They're already in losses, and they're probably mismanaged. There's a lot of corruption there, and they don't have equipment or resources. So what was happening is the nurses had too many patients in the ICU, and because there are so many patients, they were going from room to room wearing the same attire, same apron. Typically, when the nurses manage one patient, they tend to change the gowns and go into the next patient. They're also supposed to change the N95 mask, and they didn't have N95 masks, okay? So what was happening is, some of those patients were COVID-19, but some of those patients were suspect. We call them PUI, person under investigation, where the lab test has been ordered and the test is not back. Sometimes it takes 24 hours, sometimes it takes 5 to 7 days. And initially it was taking 5 to 7 days in New York City. So what was happening is these nurses were managing both patients, and they were wearing the same gown or protective equipment. So even the people who are not positive eventually will acquire the infection, because the same healthcare worker is working on both of them. And the other situation that the staff noticed there is a lot of the nurses or the techs, they were taking the subway train, and neither the hotel where they're staying or the hospital would give them the mask. So they were essentially going in the train without a mask. So even if they don't have an infection, they're probably are acquiring the infection in the train, and they're transferring them to the patients and whomever they interact with in the hospital. So that was another problem. And the other problem is the doctors were so stretched there, like they were managing beyond the load that they can handle. There's this concept of quitting, and this is talked about privately, when I'm working with coaches on my personal issues. But I'm having to bring this up publicly. So theoretically, if your doctor is quitting on you, you being the client or the patient, then you'll have really poor outcomes. Okay, that has been proven by research. So a lot of these doctors were burnt out in New York City, and they were quitting on themselves. They were also quitting on their patients. And this is very apparent in if you read some of their writings, if you read some of their blog posts, you can get a sense of that. So the common theme in most of these social media posts or blog posts is that once the tube is in, once they're intubated and hooked up to the breathing machine, then more or less they are dead. So which means they're giving up on them at that moment. So most of the times they're getting IV antibiotics, which are antibacterial. they're not getting the full course of treatment for coronavirus. Again, we don't know what the exact treatment is, but I'll tell you what happens here in Florida. Most of these patients, they get hydroxychloroquine, they get azithromycin or Z-Pak. They also get remdesivir. They get other antiviral drugs. They also get sometimes immunoglobulin, which is like an antibody. And in the beginning, in March and early April, they were even giving IV vitamin C here in Tampa. It's only 1 gram. It's not high dose vitamin C. We don't know if 1 gram of IV vitamin C makes any difference. But the doctors were trying everything. And that's what you expect from your doctor and your nurses and everybody else. You want them to try everything, even if you're intubated and you're in the ICU. You want them to treat you for the whole 20 days, 30 days, however long you're there, so that you have a valid chance of getting out of the hospital. You have a chance of survival. And lately we are noticing that there are, vast majority of people who are in the ICU are dying, but some people are surviving, which is good news. We're still trying to figure out which one of these treatments works, but we know for sure that some of them are working. Otherwise everybody would have died if they're in the intensive care unit. So let me go back to what's happening in New York City. So once they're on the breathing machine, essentially they're being neglected, and both the doctors and the nurses, they have a feeling that so and so person is going to die. So why put resources on this one person, especially when we don't have resources, which is a valid concern again. So that's one problem. So they're not getting all these expensive treatments that they may benefit from. And the other thing that's happening is they're running long tubing so that they can run the IV pumps from outside the room. And the problem with that is it's convenient for the staff to do that, but the problem with that is they're not being assessed every hour or every 2 hours, which is an expectation in the ICU. They're not being touched. They're not they're not listening to their lungs. So sometimes you may miss some key signs on physical exam that can point you to a different treatment course, or that may prompt you to call the doctor who is on call and figure out something else. So that was another concern. So you see, the system breaks down at so many different levels, and that's why you have a multiplication. Instead of 50 people dying every day, like in Florida or North Carolina, you have 500 people, or you have 1,000 people dying every day. So it's a really sad situation. But here is my personal concern. Because of what they see on TV every day, people are getting more and more scared that, now 500 people died again. Although we're saying the curve has flattened, it's time to reopen. That's what I've been saying over the last few days. They still see so many deaths. So many deaths are happening in New York City, not because the virus is fatal, but because the system has broken down completely. Doctors are committing suicide. There are probably a bunch of nurses and staff that are committing suicide. It hasn't come to the to the newspapers yet. It will come later, and it's essentially a burnout that is manifesting. It's essentially they themselves are seeing this directly, like patients are not getting the care that they need. So and they feel guilty about that at some level, whether it is conscious or unconscious. So these are some of the reasons why I think we are seeing this crisis roll out in New York City. I've always been a proponent that people in New York City should stay there, but if this continues to be the course, then chances are they're not going to get good care. So essentially, they have to leave the town. There's no other proper course of action. There's so much corruption there. There's so much money there. That's like the if you look at the numbers, the statistics, the average income in Manhattan is 75 grand. So each person is making 75K. So there is no reason why they should get such a poor care in these hospitals. So So I'm really saddened by the situation there, and this is my personal opinion. This is not an opinion from my employer or anybody else, but based on the, I can only go by what information that I have. So the goal of me explaining all of this to you is to make sure that you're not scared, that if you go to any hospital here in Florida or even Georgia, you will get the best possible care. You will not find doctors and nurses who are quitting. They're all being supported. I get 1 to 2 emails every day from my corporate bosses. I have support from family. I also have support from friends. So in a similar way, the other doctors and nurses are being supported in a lot of ways. So I cannot explain all of that to you at this moment. And we are not overwhelmed here. I'm only seeing a handful of patients who are really sick. At any point of time, there are 2 or 3 ICU patients who are COVID positive. Even if it takes 1 month, we keep them on the breathing machine, and we give them every chance possible so that they may heal and recover. So, and that is the situation in most of the states in this country, from my understanding. Okay. So it's really important, if you notice the signs of quitting in your practitioner, whether it is a nurse practitioner, PA doctor, or nurse, in your healthcare staff, if you notice that they're quitting, then it is prudent and it is essential that you have to check out the patient and move them to a facility where they're getting the best care possible. So it's not just the disease that is causing this, is the care that they receive. So I wanted to talk about that extensively. I wanted to bring you the concept of quitting. It's a very important concept. A lot of doctors don't know about it, and they may not be aware about it. But as the family member, as a friend of somebody who's sick, you should know about it. So look forward to talking to you again. Thanks for all these comments, guys. I've been watching. I was not able to respond to each one of them. So I'll continue exploring this. And as I said before, at least here in Tampa, Florida, most of the hospitals are well equipped. You'll get the most of the times you'll get the best care possible. So don't be scared, and don't be afraid. It's good to be prepared, but if you're staying in a place where you're scared and you have fear going on, and it's going on for months and months, it will manifest in the physical body, and the physical body can die. It can, if the virus is on your mind all the time, you can manifest the symptoms of the virus and you can become sick. And I don't want that for any of my friends or my audience here. So look forward to talking to you again. Be healthy, work on your immunity, work on your nutrition, be in a positive mood, go outside into the sun. As always, practice social distancing. That's what people from the government are saying, so you should all do that. And hopefully this will come to an end, and they'll open up the state soon. Okay, have a wonderful night. Okay.